webinar looking at the role of data in QI. Just as a check-in, I would like to maybe have people just type and ensure that they can hear me and that they can see the screen. So in the chat box, if you're able to just let me know that you can hear me, that would be fantastic. So thank you all for coming. We know that it is an interesting time because it is year end, and we know this is a very busy time. We also know that sometimes maybe data isn't the most exciting topic for people. So we are really thrilled with those of you who showed an interest and who shown up for the webinar, and we thank you for that. So just a few housekeeping things. In terms of technical information, if we could please ask folks to mute their phone if they have it on, particularly our presenters, and then switch on your phone when it comes to your turn. This just helps keep down background noise and let everybody get the best possible experience. The PowerPoint presentation will be emailed to you following the webinar, and that it will also be available on the E-QIP Community of Practice. So if you aren't a member of the Community of Practice, we would really encourage you to become a member, and we'll talk about that a little bit later in the webinar. At the end, I will remind you that we're going to give a brief feedback questionnaire. This is important for us, and it's important because if we believe in quality improvement, we really want to know how we're doing, and we want to make this the best possible experience for people. And somebody from the audience just emailed or texted and said that they can hear and see, so that's perfect. Thanks so much for that feedback. So what we would also encourage you to do, and some folks have already done it, you can expand the webinar functionality by clicking on the orange button, and you should see any questions or chat screen below where you can type questions. And we have somebody, Jenna Hitchcock, who is a wonderful moderator, who will be taking the questions and feeding them back to us so we can ensure that we answer your questions at the end of the webinar. So I'd like to introduce you to the wonderful team that I have been privileged to work with this year. My name is Sandra Cunney, and I am the Director of Quality Improvement for Addictions and Mental Health Ontario, and I have been co-leading with my colleague Mike Dunn, who is the Director of Quality Improvement for the Canadian Mental Health Association Ontario. And the fine panel of faces that you see in front of you are our Excellence Through Quality Improvement data coaches. We also have a group of quality improvement coaches who have, with our data coaches, been going out through the province and supporting the Excellence Through Quality Improvement work. And you will see Abel Gervais, who comes from Community Health, Alex Clement, who comes from Sudbury and the Child and Family Center. We have Andrew Span, who comes from Wayside House in Hamilton, and we have Nicole Adkin, who works with Connects Ontario. We've been very fortunate and very privileged to have this team come to work with us as data coaches from the Excellence Through Quality Improvement Project. But what it also means is, as part of our commitment in this project to help increase capacity for QI and data within the field, these folks will be going back to the field and really serving as QI and data champions. So we're excited to have them. We're also excited that they'll be going back into the field to support the good work that you already do. So what we want to do today is really talk about the role of data in quality improvement. And many times it has been our experience, and mine particularly in the field of evaluation, where often projects will get started, and then once they're well underway or towards the end, people will say, can you help us evaluate this, or can you help us look at this and assess how it's done? And what we are really encouraging people to think about is that data and quality improvement go hand in hand, and it really starts at the beginning, both from a preparatory phase when you can start to look at data and understand what's going on and where there are maybe areas for improvement, to helping define the problem, that you want to look at, and then develop an aim for what you want to achieve. Then as you go through measuring and understanding the changes that you're making and the impact of those changes, and then ultimately sustainability and spread, because I think our team really recognizes we collect a lot of data in the field. What's really important is to collect meaningful, pragmatic data that can not only help inform a QI process, but also inform other aspects of the work and also be sustainable for the long term. So we'll be taking you through the stages of QI and the related tools and concepts and how data connects with them. We'll also be going through an example, and if you've attended our ideas training that we've been holding across the province, you will be familiar with the Clubhouse example as we talk about a community Clubhouse program and how data comes into play in that example, and that will be followed by actual examples from the field that we've been working on this year. So it's also a chance for us to kind of highlight and celebrate the great work that has been going on in the field within the Excellence Through Quality Improvement project. So just a quick word on data from me, and then I will hand over to my colleagues and so they can talk about their work. So what's really important about data is that it really helps us distinguish what we think is happening from what is really happening. It becomes, if good data, a really objective source to be able to sit down and look at and say, we think this is happening. Is this actually the case, or is something else happening? This can apply to things like wait times. It can apply to wait numbers. It can apply to outcomes from programs. We may think programs are doing a great job, and when we look at particular data such as the OCAN, we might find out, yes, they are. Or we might look at the data and we say, we thought this was happening and we thought this was having an important positive impact, and we see it in some areas but not others. Let's dig a little bit deeper and find out about that. What data does is it gives us a story, and I think that's really important. Is data is just another way of telling a story. It talks about the history of problems over time, and Alex will talk to you about run charts and the value of run charts and what they can show us. It also puts a baseline for our performance. We talk a lot about baseline, but what does that really mean? So what have we been doing? What does it look like? And when we introduce changes, how can we see that manifested in data? How does our baseline change? And it can also quantify the impact of change. How much, to what degree, when, and for whom have things changed? I think most importantly, it really does become a tool and a means for us as teams, as programs, as organizations, and as a sector to really start to talk about our work that we do and tell our story in a different way with a different set of storytelling tools. One of the things that we really want to talk about is good data. And again, we collect a lot of data, but what kind of data should we be collecting? And this is an example from one of our projects that we've applied a pragmatic frame to, which is the Salvation Army Centre of Hope in London. And Glasgow talks about pragmatic data. And pragmatic data should be, as we know, all data should be reliable and valid, sensitive to change, feasible. But most importantly, it should be actionable and user-friendly, and it should be at low cost. So reliable means that we can consistently collect information. Valid means that in this case, it really does represent what is going on. So if we're looking at withdrawal symptom checklists, it really does reflect withdrawal symptoms and has face validity for clients and for staff members. That it is sensitive to change, that will pick up those subtleties that are happening while people are in programs, that it actually is feasible. One of the things that is really important is that data really follows the flow of the work, because what we know is if data doesn't follow the flow of the work and doesn't support the work, then it becomes administrative in nature, and it automatically then will impact the reliability and the validity of data. It has to be important both to the groups that are doing it at an organizational level, as well as being able to inform the larger public. So at QI lens, what is really critical is that data also be actionable. We need to actually have indicators that speak to areas where we can take improvement, where we can do actual activities to make things better. So, for example, if we're looking at symptoms checklists and we see that withdrawal symptoms are not changing or not decreasing with an intervention, and this is happening for not one person, but a group of people, that means we may need to go back and look at the intervention and check the fidelity of the intervention, or check who we're serving. Perhaps the intervention we're choosing is not meeting the needs of those clients. It has to be broadly applicable, and it has to be at low cost, particularly within our industry where funds are quite often very tight. It should actually enhance engagement. It should help to facilitate conversations in clinical supervision. It should help to facilitate conversations with clients so that they can reflect on their progress and actually have ideas about how change is working or not working and what could be implemented. And it also should enhance funders and board members to really understand the services being delivered. And ultimately, it should cause no harm. It really must be used, and we come back to this all the time in E-QIP, that we are focused on client safety, effectiveness, timeliness, and client-centered care. We've been referring to this as the 3 bears rule. So we want the porridge to be not too hot, not too cold, just right. And this is kind of the way we think about data. We need to balance that we have enough data so that it tells us what's happening without having too much data, so we're not overwhelmed and confused, which often can be the case, particularly when we're required for reporting requirements. Hi there, I'm hearing a phone ringing, so I'm going to see if whoever is there can put their line on mute so we can't hear the phone ringing. Thanks. So now what I'm going to do is turn it over to my colleague Abel to talk about measurement and how that relates to quality. Abel, over to you.
Thank you. Can you hear me?
Yes, we can. Thanks, Abel. Go ahead.
Okay. Thank you, Sandra. Thank you, Sandra. And hi, everyone. I'm Abel, one of the data coach. So in the next slides, we're going to talk about measurement and data. I think the synonymous word for QI is measurement. They go hand in hand, and when we're talking about quality, the next word comes is measurement. How do we know what we're doing? How do we know whether it needs some improvement? What is the target? How do we know what we're doing, if we're doing right? So there has to be a tool to track and measure, and it should be easy to use, affordable, and accessible. So in order to be easy, affordable, and accessible, I think the best tool that we can have right now is Excel. I would say Microsoft Excel is the friendliest tool that we can get right now, and it's it's in most computers. So yeah, it's even if you don't have the standard version, still you can have open source or free version from Google. So in this slide, it looks like a hyperbole, right? I mean, of course, it's a cartoon, but I think the reality doesn't go too far from here. As long as the data is there, of course, the data has to be accurate. Excel can do its magic. So why Excel? And as we said, has to be accessible, and Excel is actually a very powerful tool. But I think the most important thing is not only about accessibility or easy, but also it can talk to other programs as well. So let me give you an example from a recent project or a recent example. So at Madison, for instance, at Madison Community Center, we're doing a project to improve the length of data entry or charting according to the standard or policy. So initially, I was generating the data using SQL Server. It's a different software. But ultimately, I exported the data, and now it's ready for analysis in Excel. So Excel can talk. You can export things in Excel, and then whatever tool or whatever database you use, Excel is the ultimate analysis tool. And this is another example, recent example actually from St. Jude's. This is done in Excel as well as a data collection tool. But if one cannot use the form, maybe if it looks a little bit sophisticated, the data can be entered directly into Excel manually. So Excel not only as a tool for analysis, it can also be used as a data entry tool. And this is also another example, a recent example from withdrawal management system. And this data from Salvation Army Center of Hope tracks client information as dimensions for trend analysis, such as determinants of health, substance of choice, those kind of things. And it also tracks withdrawal symptom severity over time, and it tracks and analyzes the patient's issues there. So it can calculate average, and it can find also outliers. So all this is done in Excel. So in Excel, you can do different functions, and one of the most popular function in Excel, and which is quite popular in terms of quality improvement projects, is run charts. So you can, one can do easy run charts using Excel. Again, as I said, starting from the data entry into the analysis part, and using the run charts, you can create a chart, changing a chart source of data, changing a chart type, those kind of things. And I mean, to be honest, it doesn't need that much training to do that. Of course, Excel can be sophisticated as much as you want, but this can be done with very basic knowledge. And this is also another example from Makemanur to track a referral from hospital to the community residential treatment center. So the idea is to increase the referral from hospitals in the area, and this run chart shows the different referrals by time series. And doing this, as I said, doesn't need more than basic training on how to manipulate the numbers to change to run charts. I think I'm done. So I'm going to hand over to my colleague Nicole to talk about preparing for QI. Thank you, everyone.
Perfect. Thanks, Abel. We're going to focus our attention on the next few slides on how to prepare for a quality improvement project. So on this slide here, what you'll see is the model for improvement on the right. And it asks the 3 guiding questions for any quality improvement project. And those are, what are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that will result in improvement? The following section, we're going to cover the project charter and the formulation of a problem statement. And we're also going to cover the role that data plays in this stage in our QI journey. Perfect. So here, what you will see is a project charter. And just to give you a bit of background on the project charter, it's a very important tool, and it captures and summarizes the project in one document. So what it's going to do is it's going to allow someone who perhaps isn't familiar with the project to understand what is being done. It keeps the various stages of the project visible and connected so that it helps keep the team grounded and in scope. So what you can see on your screen right here is that there are various sections of the project charter. The very top of the project charter is going to give us some project details, such as the title of the project, when they're starting, what the target end date is. Now, this project charter was taken from a project that I am working on with the Canadian Mental Health Association Middlesex branch. On the left of the project charter, you will list your team members and the various people who are involved in the project. And then we'll get down into what we're trying to accomplish. So the first box is going to indicate the scope and the boundaries of the project. And this is what is going to help keep everyone on track as the project advances. All the areas that are circled in red are areas where data is actually going to play an important role in the QI project. So the next is what we have, the problem statement. So you can see here on this project charter that the problem was that there's confusion around access to service, and data demonstrates an average of 186.4 days wait times from assessment to service initiation with case management services in London. So what we're looking at here is, in order to identify that there was a problem, we used the data showing the wait times and that there was an excessive wait time in the case management program. The next box is the aim statement. So this aim statement is to decrease avoidable wait times to case management services in London from service to, in London, from referral to service initiation, and they want to reduce that wait time to under 14 days by December 1st, 2017. So data is also going to inform our aim statement as well, and it is going to let us know if we have achieved the wait time decline to under 14 days. If we want to look up at the measures section of the project charter, in this area is how we're going to measure how we know that a change is an improvement. So the different measures, which will be covered more in depth later on in the webinar, are outcome, process, and balancing. And what you can see in this measure section is that these items, for example, process, percentage of intensive case managers transitioned to transitional case managers, is a very measurable point of the project. We will move on to what changes can we make that will result in an improvement. So looking at the root causes of the problem, what we can do is use data to inform us of the frequency or magnitude of the root causes that are related to our problem. So if we take a look at item D in the root causes of the problem, for example, a lack of staff competencies and training, that item right there is very measurable. And we can measure that in terms of, for example, a survey. We could survey all of the staff to see what their competencies are and what are the trainings that they have received. And that will then give us the data to let us know if staff competencies and training are up to date. And then another example of data on the project charter is the next area, being the change ideas. So what we are going to do here is list the ideas that we are going to put forth to test changes. What we will need is for the data to tell us if these change ideas that we put in place are successful. So for example, the transition from intensive case manager to transitional case manager, item A, is very easily measured by taking all of the case managers and capturing the number of ICMs that have been transitioned to TCMs. So all right. So now we're going to go on to the problem statement. I'll just let you know that a problem statement is one or two sentences that identifies the problem or the issue that we're experiencing. And what it does is it provides a clear expression of what the QI team is setting out to achieve. It does not talk about solutions, though. So to get the information that we need to write a problem statement, we can use the tool that you see in front of you, which is the 5W2H. So basically what it is answering these questions, answering what is the problem, why is it a problem, where do we encounter the problem, Who is impacted by the problem? When did we first encounter the problem? How did we know there was a problem? And how often do we encounter this problem? And on this slide, I'm going to give you an example of a community mental health clubhouse program. And as we work through the 5W and 2H tool, I'll be able to identify where exactly it is in this tool that data is going to come into play. So our first question, what is the issue? The community clubhouse program has been experiencing a significant reduction in participation. The data that we're going to use for this would be the participation in the program. So we can measure the participation rate of a program to see that it actually is reducing. Why is this happening? Reasons for this issue are unknown, but staff think that it is likely linked to the change of locations for that program. So what we can look at here is the possibility that this is linked to a change in locations of the program, and then move on to see where do we observe the problem. The reception team has noticed that when members arrive at the old location and are directed to the new location, that only about half of them make it to the program that day. So valuable data can be gathered by looking at this particular question. What we can do in terms of data is a tally of the number of participants who arrive at the old location versus the number of participants arriving at the new location, and that will let us know where what the discrepancy is. And then more data that can also be gathered from this to help out with this question would be asking the clients the reason that they did not make it to the new location, to find out exactly where it was along the way that they got. The next is, when did we first observe the issue, and how often does it occur? The program staff and volunteers have noticed that there's been a steady decline in daily attendance over the past month. So again, an easy measurable for this question would be tracking the attendance per day over the month and over the course of a period of time, and that will let us know if there really is a decline in attendance. And the last questions are, who is impacted? How does it affect clients, families, caregivers, and staff? So the decreased numbers in participation in the community clubhouse are impacting the quality of relationships and programming available to members of the clubhouse that are regularly participating. Those members that are not attending do not receive the same level of service and programs that have helped them when attending regularly. So, and again, data can play a role in helping us with this question as well. And what we can gather is the satisfaction rates of the clients by doing a simple survey and surveying the clients of the clubhouse. I'm now going to hand off the presentation to Alex, who will discuss diagnosis.
Hi, thanks very much, Nicole, for that lovely introduction to the model for improvement, as well as preparing for quality improvement. So now that we've defined what we think is the problem with the process, we can use diagnostic tools in order to sort of flesh out the root causes of the problem, as well as the vital few that are contributing the most to the problem itself. And that gives us a good idea of the direction we want to take for our quality improvement project in order to have the most meaningful impact while we're trying to achieve improvement throughout the process. So as we're defining the problem, I'll introduce you folks to a couple of tools that we often use in quality improvement, and those are the process map, the fishbone, the Pareto chart, and then we'll discuss creating an aim statement. So a process map is a really handy tool that can often be used by project teams in order to identify the actual sequence of events or flow of a process itself. So for example, a referral process probably has multiple steps that involve a client either phoning the organization or getting a referral from a secondary organization sent to you in terms to when that individual is actually accepted into service. So by mapping out the steps associated with this and involving all members in the conversation, whether it be clerical staff, frontline staff, or management, you can get the fulsome picture of the process itself as well as the complexity. and identify any areas where there may be problems, whether it be redundancies, multiple steps that don't have value add, unnecessary loops, or bottlenecks. And once these are identified, it can kind of direct attention towards how the process itself can be standardized in order to simplify, reduce variation, and create more consistency in the process itself. A process map can also help in data collection. You can identify points within the process that we can measure and determine, again, areas for improvement or whether changes can be made in order to make the process more lean. And you can also test changes for improvement and use the map itself to inform staff what the process would look like between the current state as well as the future state if you're planning on making any changes to the process. So this is an example from our Community Clubhouse case of a referral pathway to the Community Mental Health Clubhouse program. So as you can see, there's different shapes here that identify different points within the process. So the more oval shapes refer to start and stop points. So on the left-hand side, we can see the referral points, so whether it be referred by a health provider, family members or friends, or a self-referral. And towards the bottom right-hand corner, we see the stop point, so whether the individual was referred to another service. Within those points, we see squares, which indicate steps that are sequenced out from start to finish. And when we get to the triangle, that is a decision point. So you can see that whether people are going for a home visit or not, they could branch out in different places within the process itself. And in terms of data collection, we can see here that there's many opportunities to get information that will kind of inform us of what the process looks like. So whether it be number of referrals at the beginning or percentage of people who go to the next stage with the home visit, so percent that proceed to the home visit versus percentage that don't, etc. I was fortunate enough to work with an agency within the province, and they did a process map for a referral program to a referral process to one of their residential programs. So you can see here that it's not a complicated process. You don't need fancy software to do this. Oftentimes it's just all you need is pen and paper, or oftentimes people will use sticky notes to try to write ideas on so they can easily be moved around depending on the conversation and what the sequence of events is. And this team also looked at touch time, so the amount of time that was associated with each task. And throughout the process, they were able to identify some areas where there was steps that didn't add value, and determine the flow efficiency of the process, and do a further analysis of where they can kind of focus some of their quality improvement processes. Another helpful tool is the fishbone diagram, and it's called the fishbone because it looks much like a fish skeleton. It's also called a cause and effect diagram. It has a couple of different names. So this is another tool that can be determined or used by a group of individuals, a project team, to help identify potential root causes that are contributing to the problem. It can help predict potential failures in a process or system, and it is, again, another really good tool to help just generate that conversation around where people think issues are arising and what's contributing to the problem. Oftentimes we use the 5 categories: people, providers, policies, processes in place, or the 5 Ps, but that's not to say that other categories might not arise. Some people will actually do the brainstorming of the root causes beforehand, and then kind of as themes arise, create the categories at that point, depending on what the information is that's being collected during the brainstorming session. So we have here our example from the Community Mental Health Clubhouse. So on the right-hand side, you can see they've listed their problem statement to kind of direct their brainstorming. So they're trying to determine the causes that contribute to the reduction in daily participation at the clubhouse. And you see here they identified some issues such as bus schedule issues under place and equipment. They identified long-time staff members retiring under providers. Under processes, they identified that notification process of the location change might be an issue that's contributing to the low attendance. And again, you can teams may come up with a lot of issues, or there might be a few issues depending on the problem that has been identified. So we see here another example from the field. So this team, their organization was having issues with compliance with the self-audit tool for hand hygiene compliance. So their project team sat down and discussed some of the issues that might be contributing to this low return rate of self-audit. So they identified that under processes, it might be an inconsistent orientation, or it might be that they're not engaging off-site staff. Another issue may be that they're not getting the information about the process out to all their external sites, or it could potentially be a policy issue with infrequent self-audits or lack of audit completion. They identified a few issues that could be contributing to this problem overall. And then in terms of determining of those issues, which are the vital few, so the ones that are contributing the most to the problem, we can use a Pareto chart. So again, the Pareto chart helps us to kind of focus our improvement efforts. So by identifying those vital few, so the major contributors, we can direct our quality improvement efforts towards those contributors in order to get sort of the most bang for our buck in terms of creating a change. So again, once we identify root causes that make the greatest contribution, we can use that information to see what the cumulative contribution of each cause is to the possible problem. This also applies to the 80-20 rule, known as the Pareto principle. So there are a lot of handy tools online in our community of practice that outline the details for creating a Pareto chart. We're just going to kind of do a high-level overview here. So going back to our community clubhouse example, these folks just did a very simple data collection. They used a tally chart and surveyed individuals that presented at the clubhouse, and they asked those individuals if they experienced any issues on getting to the new program and what those issues might be. So some identified that bus schedule issues were an issue. Looks like 10 said that that was the problem. Several identified that they were unsure where to go, so what bus to take. Some said that the cost of the bus was prohibited, and you can kind of see that right off the bat there's some root causes that are identified more often than others. So those would be the major contributors. So when we create our Pareto chart, we line up from the greatest responses to the least responses, and we can calculate what proportion each one of those responses or root causes is identifying to the overall problem. So we see here the largest contributor was identified as getting the clubhouse members, or the clubhouse members are getting lost on their way to the new occasion, so that, or the new location. So that would be an area where they'd want to really put their efforts, because they can alleviate a lot of the problem by improving this process, as well as informing people where to go and what bus to take, as well as potentially helping out with the cost of the bus. So the hand hygiene group, once their project team created the fishbone diagram and identified what they felt were some of the major contributors of, and the root causes to the issue of the poor self-audit compliance, they decided to engage their staff and created a very short survey, and they asked staff what staff felt would help in getting a higher completion rate for the self-audit tool. And when they collected the information, they found that the feedback from staff was very similar and echoed what the project team had thought were root causes. So staff identified that the process was unclear, or it was a difficult process to follow, and that's probably why there was poor compliance. So if it was an easier process, people would be more likely to complete it and return their surveys. They also identified Incentives would be helpful, as well as an increase in education and messaging around the process itself. So that will help the team decide going forward where they want to focus some of their quality improvement efforts in order to improve the process itself. So now that we've talked about what the problem is and getting all the details and sort of really defining the problem itself and where we want to go, then we can talk about, in terms of the models for improvement, what are we trying to accomplish? So our aim, how will we know that we've created improvement in this process? So a quality aim statement often follows the SMART acronym. So it addresses an issue that is important to those involved. It's specific, measurable, attainable, realistic, and time limited. It also identifies or addresses, these 3 points. So an aim will address how much, by when, and for whom, or what part of the system that they're working to improve. So the example here from the clubhouse is, we will increase the daily participation of the existing community clubhouse members at the new program location by an average of 8 people per week by March 31, 2017. So you can clearly see that they identified how much, so an average of 8 people per week, by when, March 31, 2017, and for whom, so the daily participation of the existing community clubhouse members. Once our hand hygiene team, I went through all their diagnostics and really defined their problem. They set their aim as to increase hand hygiene self-audit completion rates from 50% to 90% by November 30th, 2017. So again, we can see the how much, by when, and for whom. So now that we've really defined our problem and determined what we're trying to accomplish with our aim statement, we're going to talk a little bit about data and measurement and how these inform how we know when a change is an improvement. So data and measurement are two terms that are often used interchangeably, but they are different in that data typically refers to the raw numbers, and that measures usually require a calculation, and they provide context to the data itself and what the data is describing. For example, if an agency says that they want to train all of their frontline staff in a new assessment method, such as the OCAN, and they say, okay, we've trained 10 staff, 10 would be the raw number, so the data, but in terms of that number, if they have a staff of 100, that's only 10%, so that's the measure. It provides a lot more context, whereas they have a staff of 10, they've trained 100% of their staff. So it just kind of frames the data itself and provides more context in terms of our quality improvement process. So we're going to talk a little bit about the family of measures as well as run charts. And we see here that in terms of our measures, we've identified that there's the outcome, the process, and the balancing measures. The outcome really describes what it is we're ultimately trying to do. What are we trying to accomplish? It's sort of the counterpart to the aim statement, and it's the voice of the client. And it also tells us whether the changes that we've created have affected an improvement in our overall goal. The processes itself are the voice of the system, and they help us determine whether we're doing the right steps to affect change downstream in our outcome. And they, again, kind of describe processes or the system and how it's functioning. The balancing measures are sometimes called the voice of the naysayer, because as we all know, if we're trying to affect change in one process, it usually has repercussions in other processes around us. So things don't typically happen in isolation. So it measures other parts of the system. And we have an example here from one of our projects that we were working on. The project team wanted to identify the % of clients who reported being engaged in the creation of their recovery plan. A kind of sensical process measure for that is identifying the % of completed recovery plans, because obviously clients will not report being engaged if recovery plans aren't being completed at all. And the balancing measure, so kind of the secondary effect, was looking at the percentage of clients who report moderate to high satisfaction with their recovery planning. So as we're improving the process and making sure that recovery plans are being completed and that clients are feeling engaged, are we also seeing an effect in client satisfaction? We can measure that as well using things like client satisfaction surveys. Another example is from the project charter that we saw earlier that Nicole presented. So the outcome here was wait time, and this also speaks to the importance of having a data collection plan and making sure that the information that's being collected is done consistently in a way that everybody is measuring the same thing the same way. So they identified that the indicator for the wait time is decreased wait time days from referral to assessment, and further define that as the number of days from referral, which would be the first contact, to assessment, which is the assess for service eligibility step. So by providing this definition, people will know exactly what it is that they're measuring and how to measure it. So again, that we get that consistency and that accuracy, so we know that what we're measuring really speaks to the process and isn't going to give us an unrealistic idea of what's going on. They also identified 3 process measures, including number of referrals, which was defined as the number of referrals in a certain time period, whether it be a week, a month, a quarter. They'd probably further flesh that out so everybody was doing things consistently. And they also identified a couple of balancing measures, such as the number of new cases and services, which is the number of new cases that the case managers picked up in a defined time period. So now that we've had all this data and we understand the measures that we're going to be looking at and how those are progressing over time, it's helpful to have a tool such as a run chart to see how the data changes over time and whether we're affecting a change in the process. So a run chart is just a simple graph that's plotted over time, so a line graph, and it's, again, another tool that's useful to bring to a project team and say, okay, this is what's happening, this is the information we've collected, this is what things look like, so that you're not just relying on kind of anecdotal evidence. It's also very easy to interpret. It can help lay out what the baseline of the process looked like before implementing any changes or any quality improvement initiatives, and it can help identify opportunities for improvement. Once changes are being made, we can see along the way whether those changes are causing an increase or a decrease in the system, or whether things are remaining steady. If the changes have already been made and things have kind of progressed in a way that is reflecting an improvement, and those are held steady, we can determine whether it would be a good time to spread this project. So if it's been effective in one process, would it be effective with a different program or different staff, etc. So a lot of helpful information can be gleaned from a simple chart. So here we have an example from one of our participating projects that looks at the social enterprise, which was a catering business, and we see here the net sales over about a 2-year period. And as you can see, the net sales are quite erratic, so they aren't consistent at all, which really spoke to the team and said, okay, if this isn't consistent, then we probably need to improve this process so things will be a little bit more consistent and we see things improve over time. So the red line here is the median, and it does reflect kind of the middle of the ground behavior of the system. And once this team starts moving forward and implementing their changes, they can see what the new median is and determine whether their changes have had an improvement in the process and whether they want to keep doing more of what they've already started, or sort of help them decide where their next steps will be. So I'm going to go ahead and pass it off to Andrew so he can talk to you guys about Plan, Do, Study, Act.
Awesome, thanks, Alex. So looking at, I just wanted to introduce a section and basically talk about how data ties into the PDSA cycle and where those pieces they fit into each part of the cycle. So just for, whoops, Stacy. So reviewing, sorry, give me a second here, guys. So reviewing our the model for improvement, basically as we've seen through the presentation so far, we've gone through the process of planning for our QI activities, defining the problems, and measuring and understanding what we're trying to accomplish. Basically taking our QI ideas and concepts and supporting them with data to tell an objective story to flag whether or not we're making improvements. So looking for the actual PDSA cycle, at various points in each part of the cycle, you're going to basically be focusing on certain pieces of the data and also constructing different pieces of your data collection plan and setting up your data collection processes. When we're looking at the planning stage, we're really looking at, what is the objective of the project? What are we trying to prove, or what type of information are we trying to gain? We want to start to take some data and create some indicators to basically test our hypothesis. And as we start to implement change, then we'll start to see if our hypotheses are right, basically based off the activity of the indicator. And at this point in time in the planning stage, it's really important to create a plan for data collection. I can't stress that enough, that when we start to get into the actual project itself and we hit the ground running, we want to make sure that we have all of our data points mapped out. We understand what we're collecting, with what time interval, who is collecting it, and where is it being collected. We move into the do component of the PDSA cycle. We're basically taking the framework and the plan that we've set up in our planning phase, and we're starting to collect the data that's going to tell us whether or not our change idea is a success or an opportunity to basically fine-tune it and look for other opportunities. When we get to the study portion of the phase, we're going to basically take our data set and look at it and try to understand, what story is this data telling right now? And basically, what are the results of the metrics and the analysis that we've set up to support our project? And can we conclude that we've been successful or that we've made improvements? And basically, all of this is to support the ACT part of the phase, at which point in time we're going to look at whether, are we going to adapt this idea? Are we going to take it and improve it some more? Are we going to adopt and implement an idea? Or are we going to abandon something because it didn't actually work as we thought? So from the IHI website, we have this Plan, Do, Study, Act tool that is really useful in terms of mapping out the various PDSA cycles within your project. I'm just going to take some time to look at this and see where exactly data ties into it and what the importance is. So at the beginning of this section, basically when we're setting out the planning part of the phase, and like I said before, we want to basically identify, are we developing an idea, are we starting to test an idea, or are we putting something into implementation? A quick point on that is that we don't want to always jump to implementation. We want to do a fair amount of development and testing first to make sure that by the time we get to the implementation part of the phase, that we are relatively assured of our success and that we are efficient in using our resources at that point. And during this part, we really want to see, what questions are we trying to answer with our PDSA cycle here, and what are the predictions? How do we compare data in order to support this? And touching on the data collection plan, the key components to a data collection plan when we are constructing is that we want to start by specifying the objective for the measurement, and this is really defining our scope for how data is going to support our project. We want to identify relevant measures, and this is really important too, that when we're looking at data items, we want to consider data items that tell a story about what we're trying to accomplish. We want to make sure that they are relevant to the project that we are embarking on. We want to define the operational procedures for data collection, basically what is being collected, who is collecting it, how is it being collected, where is it being collected, and when is it being collected. And from then, we're basically ready to start collecting data and move into the due phase of our cycle. And basically, our data collection plan is going to be related to various outcome measures at the high level concept of our projects. We'll look at the various process measures to ensure that, you know, basically what type of progress are we making in accomplishing our high level outcomes. We'll look at the different balancing measures to make sure that we're not making any unanticipated negative changes in other parts of the system. And then we look at different other measures that we can set up in order to test different change ideas. So basically here is a very brief component in order to map out a data collection plan. And again, it doesn't have to be long and exhaustive. And the idea is not to create a data system that is going to take away from actually being able to use the data. And this is just a great tool in order to efficiently set up a plan so that we understand what's going on. So when we're looking at the components here, basically two things. We're looking at what data is being collected and putting it through the different W-based questions. And then we want to set up the necessary tasks in order to ensure that we can collect that data and where data supports the different processes within our project. When we get to the due part of the PDSA phase, most of the bulk of the work has been done because we've set up the mechanisms for data collection. We've outlined our plan and assigned the responsibilities. At this point, we're going to be collecting the data that we have set out in our plan, and then we're going to be periodically observing this during the test in order to try to gain some more information. And basically, the idea is as we do more PDSAs, we do more iterations of our improvement projects, we gain more information and we make better decisions and we have a greater outcome. And then when we get to the study portion of the cycle, what we're going to do is basically collect all the data, look at the complete set, and then map out a number of different conclusions based off of this data set. And we can look at, you know, what type of improvement do we make in our outcome and our measurements? You know, what types of things do we have to consider in terms of balancing measures? We're going to look at, you know, from here, what do we do next? You know, what things worked for us, what things didn't work? Where are there opportunities for improvement? Where can we do things better? So at this point, we're really trying to, you know, take all the data and objectively look at it and say, what is the story that's being told? How is this going to benefit us? And how does this aid our organization going forward? And then at the last piece of our PDSA cycle is the ACT portion, and this is really one of the shortest phases because it's really a decision. And from here, we're going to look at, you know, have we done enough development and testing to be able to start to implement, and then can we start to create a plan for that? And then looking at, you know, now that we have this information that we've gathered in this cycle of the phase, what are we going to do for the next cycle? Do I have to go back to my project charter? Do I have to tweak some of my the scope and direction of my project based off of new information that I have? And this is really where you're drawing conclusions and setting up the direction for the next cycle of the planning phase. So looking at an example here from the field, and this is Oak Center, and to give a little context to their project, what we're looking at is basically improving client outcomes, and there was a certain amount of evidence that would suggest that by completing the OCANs and linking active members to treatment plans and getting those members engaged, that they could improve the client outcome there. One of the problems that we had come across on one of the pain points for them was the OCAN training in terms of employee turnover. Some of the information was not getting passed on to the new employees. And we really need to figure out a way to prioritize the OCAN and create a structure that would be conducive to completing it. So when we completed the fishbone and identifying some of the root causes to the problem, what we identified is that the main causes were a lack of capacity with respect to technology in terms of, you know, using the system, understanding where everything is, and then also the work breakdown structure of the day in terms of prioritization of activities. And from this, the first part of what they're trying to accomplish is developing an organizational breakdown of work And considering the OCAN completion as part of that, basically identifying different pieces of the process and identifying opportunities to streamline, modify processes to basically reduce employee workload and become more efficient. And then also developing a data model and also the various training mechanisms to support the quality improvement projects, the model for improvements, and basically to basically track the data items related to completing the OCAN and start to basically compare, is the OCAN completion rate, as that increases, is that increasing the client outcome? What type of workload capacity issues are we dealing with? And where can we start to make ourselves more efficient? So with this, we started to develop an Excel-based model that would consolidate data and information from multiple sources, and it's built in a way that is user-friendly. It doesn't use a whole lot of high-level functionality, but it gets the job done, and it acts as a great comparison and analysis tool. So with this, what we're starting to do as of April 1st is to collect some baseline information. There's some historical information that can be input into there, but we're going to basically start the development process for identifying the priorities of the organization, getting the OCAN training and the infrastructure in place, collecting our baseline data so that when we start to basically implement the change ideas, different ideas down the road, that we can look at the increase in the OCAN completion and start to compare it across a number of dimensions. So why do we really do this? And well, it creates a concrete basis and a quantitative basis for us to work with in terms of identifying priorities and maximizing the client outcome, which is the real purpose at the end of the day. We've consolidated data from multiple sources in a user-friendly way, and we basically create a mechanism for improving the workload and the flow within the organization. And when we're looking at the data collection plan, we're looking at collecting the weekly entry of data just to monitor at the beginning of the project and then start to expand that out as appropriate given cycles later down the road. So with this, right now, what we're really looking at is expanding the database model to make sure that it contains all the metrics that we want, look at opportunities for internal training and expanding the technological capacity of the organization to make better decision making, and then looking at identifying some run charts and graphs and pivot tables to basically get a multi-dimensional view of the data and understand problems from a different perspective. And from here, what we're looking at is once we collect all the data, we'll start to identify, which change ideas had the greatest effect. Is the OCAN completion rate a good metric to base the client outcome? What other types of things in terms of client outcome can we measure that would improve our ability to basically say that a client is moving forward and that their quality of life is improved? And then start to build on this and spread this throughout the organization and look at different opportunities to build on the efficiency gains and the quality improvement gains. So a couple of other examples of how data can be used by different organizations within the sector. We're looking at a withdrawal management interface that's being developed in London right now that basically takes individuals who are experiencing withdrawal symptoms and we track the severity of the symptoms experienced over a series of checks over time. We're really tracking two pieces of data there, and one of which is the different dimensions of the client. So things like demographic information, age, we look at different determinants of health, look at substances of choice, and then by aggregating this information over time, what we should be able to do is set parameters for averages and start to identify some of these outliers and basically predict when an individual is moving towards a crisis incident or when an intervention strategy needs to be put into place. And this is really in response to the number of different substances available, the harshness and the potency of the substance available, and the increasing complexity of the clients. It's really necessary to start to understand for these different subsets of individuals what are some targeted strategies that can be used in order to maximize their experience and again, being preemptive in order to save costs later on in the system. We look at this through a number of different ways. We can do a, in the previous slide, basically a chart by chart comparison. As you can see over here on the right-hand side, second to the right, there's an individual who was experiencing subjectively more distress in a particular symptom than a lot of others, and that's the type of information we'll be looking at for clients identifying individuals at risk. And here over time, we can start to look at, the trending of different withdrawal symptoms tracked over time. And we can look at this by different categories of substance of choice. An individual who is withdrawing from opiates, heroin, fentanyl will have a different trajectory and different things, indicators to flag improvement or moving towards a critical incident. And that's going to be different from someone who has primary alcohol addiction or primary cocaine addiction. What this does is by tracking these different symptoms over time, we can start to assign different trend lines and patterns to specific dimensions. And it's not just limited to substance of choice. We look at things like, is there a mental health condition identified, different determinants of health, socioeconomic status, and start to really target some strategies to maximizing client outcome, again, being proactive and preemptive instead of reactive, because again, we're trying to maximize the client outcome while as a system minimizing the cost. And with that, I'm going to pass it back off to Sandra to take us through the sustainability components of the presentation.
Thanks, Andrew. Hope everybody can hear me. Thanks to all of you for really kind of giving us a great overview of different ideas and different points at which data plays a critical role all along the quality improvement process. But we talk a lot also about sustainability, and I think the thing that we've been really mindful of in this project is how do we create systems and structures around data that are in fact sustainable. And when we look at Baker's work, Baker talks a lot about what are the factors that are required for the sustainability of QI initiatives. And we see these factors here in terms of culture, leadership, strategy, structure, resources, information, communication, and skills training. And what I would suggest is that not only are these factors important for quality improvement, data comes into all of these factors as well. Is there a culture that exists that supports and embraces data and the use of data? Is there leadership that uses data for decision making? Are there strategies and policies in place? And are there data structures that link to other structures within the organization that allow for communication around data? And data actually falls under the information element or factor here. But at all levels, these organizational factors can really apply to data, and ensuring things like you have people or access to people, even if they're not maybe people in-house, such as our QI coaches who have the skills and the training who can support data and the role of data within a QI process and structure. Again, thinking about sustainability, Andrew touched upon this in the Plan, Do, Study, Act cycle, making sure that the stuff we're doing in terms of our change ideas and that we're implementing, we're starting small, we're collecting that information, and we're doing the tweaking and the improvement along the way, or the decision that maybe we need to stop this and take another route. So when we think about sustainability and those factors that go into sustainability, testing is one of them, and how you start. Other areas where data comes in are using data to look at the spread of the work and to be able to tailor the work to the local context. That's really important, and making sure that you're looking at data on a very regular basis. And then finally, really also making sure we're not just looking at outcomes, but those important process and balancing measures. Because without the process and balancing measures, if we're not changing the process, which is really fundamental to quality improvement, we're unlikely to be having an impact on the outcome. So We hope that we have given you a useful overview around the role of data in QI, all the way from preparation to diagnosing problems to measuring and selecting improvement ideas and then testing them for a PDSA. I think what's important to really focus on is many of the things that we've talked about or shown today are really quite simple. From a tally sheet to a frequency sheet to creating a run chart. These are fairly straightforward tools that can use Excel and be used in Excel. And we also want to emphasize that not only are we talking about quantitative data, we're talking about qualitative data. So when you think about that PDSA planning tool in the Do section where it says, what are you noticing, what are you observing, that qualitative data is important. The fishbone, when you're getting feedback and themes from staff, that's qualitative data that can be categorized, and that's really critical too. Process maps themselves are qualitative data. So qualitative and quantitative data have a really important place to all of quality improvement. All of the things that you've seen today and the tools that we've talked about are actually available on our cloud of community of practice for E-QIP. If you haven't joined, we would encourage you to do so. The webinar will be there, the resources, and also some really important conversations for people who are doing this work. So to learn more about E-QIP, you can reach us at these websites, or you can learn more about us at this website. And you can feel free to contact myself or Michael Dunn, and we'd be really happy to answer any of your questions. And if you've enjoyed this webinar, we would like you to tweet us at #equip.on. And if you haven't enjoyed us, please tweet us at equip.on, #equipon. And we will remind you that there's going to be a survey at the end of this. And again, we would really appreciate your feedback because we are interested and invested in quality and quality improvement. And now we'd like to open it up to see if there are any questions that anybody has for us. Are there any questions that we have, Jenna? No questions. Okay. Well, we'll hang for a few more minutes. We'll stay with you until 1:15. And if there are no questions by that time, then we will thank you so very much for taking time out of what we know is a very busy schedule at this time of year and for joining us in this webinar. So we just had a question come in that said, any suggestions for improving staff engagement in QI initiatives? This is a fantastic question. And in many ways, we've been seeing QI actually as an engagement tool for staff. And so when we look at the model for quality improvement that is supported through Health Quality in Ontario and IHS, Institute for Health Care Improvement, QI is actually really seen as a collaborative process. And so in your project charter, when you're starting to build and form your team, you want to bring in people who are very close to the issue at hand and who are kind of your subject matter experts within the organization. And if you're dealing with partners in a particular project, bring them in as well. But many of the tools, such as the fishbone and the process map, are amazing opportunities for really getting staff voice, getting staff perspective, and using them as tools for dialogue about what's really happening. Run charts, and though I know it sounds kind of odd, getting a run chart and sitting down with staff and saying, what's going on here? What do you think is happening? What does this data mean to you? There was a really high point here or a really low point here. What do you think was happening, or what are you aware of that was happening? So even if you have your project team, taking these tools out and bringing staff in to be a part of the kind of quote-unquote data collection process or discovery process can be very, very powerful. And also, having had the experience with some of the projects, really trying to ensure, if possible and feasible, that client voice is always also represented. We've done some work in experience-based co-design. It's another methodology where staff and clients or consumers can be really engaged in understanding the flow of the work and the process and what their experience is at each point in that process. So a lot of tools that are actually QI tools can be used as engagement tools. Hope that that answers the question. Are there any other questions? Well, thanks again. We really appreciate you taking part in this webinar. And if there's anything else we can answer, please feel free to email us. And we are wishing you a great day and look forward to connecting with you and other things and in future webinars. Thanks, everybody. I think we'll sign off now.